Friends, how are we doing with Kate Middleton and the cancer she has, diagnosed by herself yesterday? A bombshell announcement. And let's see, because a doctor speaks in reference to her cancer. What type of cancer could she have and why she is undergoing this preventive chemotherapy? So, if you agree, let's get started. I believe no one is better than a doctor who can explain a little bit the reason why Kate Middleton is undergoing preventive chemotherapy. What is preventive chemotherapy? We understand it's for prevention, but maybe it's because it's not serious, just in case. Or what does preventive really mean? So, well, as Univision News says, a doctor is going to explain it well. A myriad of theories today. The Princess of Wales confirmed with her own voice what had kept her away from the public eye. Well, she says that at that time when she underwent abdominal surgery, it wasn't known to be cancerous. Wanting to clarify also, be careful with this, wanting to clarify because at that time it was said to be cancerous, it wasn't cancerous, it wasn't cancerous. Yes, it's true that in the statement it was lied about because at the time of the surgery it wasn't cancerous, but days later the British royal family clarified that it wasn't cancerous, so there wouldn't be speculation, which is a lie. I understand it was to protect the children and all that. We understand it, but it was a lie. It should be made clear that at that time it was a white lie to protect the children, and I understand it. The surgery was successful. This does shut down many mouths like Concha Calleja's party saying it was induced coma and such. I don't think I would have dared to give that information, even if it had been the best source in the world, honestly. However, subsequent tests after the surgery found cancer. The princess explained that after the diagnosis, her medical team decided that it was best to start a round of chemotherapy for preventive purposes. It is important to note that the princess did not mention the type or stage of cancer she's facing. We've explained this more than once with King Charles. If we don't know the stage or type of cancer, we can't speculate more or less where things are going regarding how much of a chance of recovery she might have cancer or the stage it's in. We can't have more or less peace of mind. They might or might not have it, depending, I insist, on knowing what type of cancer it is and in what stage or condition it's in. But the fact that she mentioned the word preventive clearly suggests that it's likely in an early stage. Kate asked the public to understand that this took time for them to process, but more than anything, time to explain it to their 3 children. Let's remember, her eldest son George is already 10 years old, an age at which a child can begin to understand what a cancer diagnosis might mean. Depending on the age of the child, it can be explained in one way or another. A 10-year-old can understand things better than, obviously, a younger child like 5-year-old Louis. This also puts to rest a lot of speculation. Having William by her side is a comfort for her. The issue of Rose Hanbury and such seems to be put very much aside. The UK Prime Minister Rishi Sunak reacted, saying Kate has the support of the whole country and showed great courage with the statement she gave. Without a doubt, this is an important challenge for the British royal family. It happens just when last month King Charles confirmed that he also had a cancer diagnosis. Kate, according to multiple polls, is one of the most popular members of the royalty for all the information. Well, the polls of the crown, as experts say. We won't continue talking about this important news because, although the details of the type of cancer Princess Kate Middleton has are unknown, it should be remembered that she underwent this abdominal surgery months ago. Our next guest is Dr. Jonathan Vienna, a surgeon and spokesperson for the American Cancer Society. Thank you very much for joining us. Good afternoon, Doctor. After it was revealed months ago that Princess Catherine of Wales underwent this successful abdominal surgery, how likely is it that there's still presence of this type of cancer, as the princess says in her words? You know, when you undergo surgery and then undergo preventive chemotherapy afterward, it means that they've actually removed all the cancer in that initial surgery, and the chemotherapy we do after surgery is to prevent what we call micrometastases or metastases that we don't see. So, it's becoming clear. Well, it's good news. It's good news because, of course, we're talking about them having removed everything that they perceive to be wrong in that abdominal operation, and then, well, metastasis when it's in a very advanced stage, it's visible. It's palpable, you know, because who hasn't unfortunately gone through? In some family members, and it's true that, of course there are tiny microcells that aren't detected, which may be cancerous, and as a preventive measure, she's undergoing chemotherapy to eradicate them. If there are any, because maybe there aren't any, as everything has been removed properly and there are no cancerous microcells. But just in case, as a preventive measure, they're doing it. So, these are good news that perhaps it's not so serious and it's been detected in time, not by chance due to the operation because they didn't know she had cancer. As explained, it's to prevent it from turning into cancer again. And exactly, doctor, what kind of tests are done now to check if there's still cancer, and how is the progress or spread determined? Some organs could also be compromised. It all depends on the type of cancer it is. Obviously, she didn't say what type, but she said it was abdominal. For a woman of her age, it could be a gynecological cancer or of gynecological origin. There are many organs there, and it could be any. We don't know exactly what it is. It could be colorectal cancer, but each of these cancers has a different way of treating and preventing its recurrence after surgery. So, it all depends on what type of cancer it is, of course. And although these details haven't been given yet, they did mention preventive chemotherapy treatment. How long could this treatment last, and what could happen to her in the future? Well, it also depends on what type of cancer it is. But when you're giving chemotherapy, it's usually not a single dose but several doses over several weeks. Chemotherapy depends on what type it is. Usually it's a bit hard on the system, so they need to be well. As we've explained in other videos talking about King Charles, there are many types of chemotherapy. Some are less aggressive, where you don't even lose your hair, or lose very little. So, that's why we see King Charles, and you've asked us many times, why he's not losing his hair. There are many types of chemotherapy, some are more aggressive. According to what Rishi Sunak, the British Prime Minister, said, it was detected in time, so perhaps such an aggressive treatment may not be necessary, and they prefer something milder that will have the same effect. They need to examine her very frequently for good health. And also, the duration and type of chemotherapy depend on the origin of the cancer exactly. And also, King Charles III was diagnosed with prostate problems and cancer, and he's undergoing treatment. What would be the difference between Princess Kate Middleton and him? Well, they're very different cancers, or they could be, obviously. We don't know what type of cancer each one has, or at what stage each one is in. It's true it seems that it's not because it's preventive that it's detected in time, just like with King Charles. Hopefully, that's the case, but we don't know exactly what each one has. If they have different things or different cancers, obviously they'll have different treatments too. We don't know if hers was completely removed with surgery, or at least that's what the reports say. So, the treatment and follow-up mean that the cancer has been treated with chemotherapy and they're following up to prevent it from returning. Yes, and the prince's situation is a bit different. And we have to talk about something quite important, the children. How should a young child be told or explained that their father or mother is going through a delicate health moment like Princess Kate Middleton? What recommendations do you have for parents? Well, this is a more psychological issue, but doctors are used to psychological issues too. They're also trained on how to deliver news. On one hand, they need to empathize with the client or, in this case, the family members. But they also need to be firm and not hesitate when delivering news. This is important for us to know in general, how to tell young children that their mother has cancer. The American Cancer Association has some well-written guidelines, and it all depends on the age of the children. As we mentioned earlier, a 10-year-old child may not fully understand what cancer means, but they know when someone is sick. So, how you talk to your children depends on their age. But the most important thing is to maintain communication with your children and reassure them that everything is okay. You shouldn't try to change their lives too much. A white lie to children, well honestly, I believe what it implies is a white lie until the end, whether it's true or whether she will recover or not. But every age is a bit different in how you communicate with children, of course. Thank you very much, Dr. Vienna, for joining us. Well, that would be all. It's really revealing what the doctor said. In the end, we have to rely on. That's why I look for information that may interest you, to understand a little how Kate Middleton can handle it. Well, the fact that it's preventive is good news. So, we'll stick with that. The fact that it's preventive means that the surgery went well, as Kate said, but as a precaution in case there's any malignant cell, because that's not something that's easily detected. So, they're giving her a type of chemotherapy to prevent it, which wouldn't be entirely bad news considering the seriousness of cancer. See you in the next video. Leave your comments. Greetings.